So today we will be discussing a case of a cut injury. The patient had been working in patient is an industrial worker had been using a heavy blade for cutting some object, and accidentally the blade fell onto his leg and he had got this injury. So the patient had got an earlier operation done for some similar kind of injury, and he had got a tendon tear, and again the patient is coming with a complaint of inability to dorsiflex his fingers. So the doctor is suspecting tendinous injury. So looking at the coronal scan, we are able to see this susceptibility artifacts which are seen in the superior most section. So this is the skin. Going beneath it in the subcutaneous plane, also we are able to see some susceptibility artifacts, and in this region we are seeing one tendon which is going along the anterior aspect, and it is continuing up to the mid part, and beyond which there are got some susceptibility artifacts from prior sutures. Otherwise the continuity of this tendon is not seen. And if we come more anteriorly, then we are able to see the tibialis anterior tendon, the medial most amongst the anterior compartment tendons, and just besides it we would have the extensor hallucis longus tendon. This is the extensor hallucis longus tendon, and besides this we would have the extensor digitorum tendons. So now let's closely observe it amongst the patient in a axial scan. So in an axial scan coming from superior most sections, so this is the anterior compartment, we see some kind of fluid and edema within the muscle bellies. The anterior and the medial most one would be the tibialis anterior, then comes the extensor hallucis longus, and then would be the extensor digitorum tendons. So if we go inferiorly, we start by tracing this tibialis anterior tendon. We go inferiorly, this is the marker over the site of the suspected injury. So there is diffuse thickening and heterogeneity within the tendon in the region of myotendinous junction, and as we go inferiorly we see there is a clear fluid gap with the absence of the tendon. So the tendon is not seen at all in this region, and this appears to be the torn stump of the tendon, which is the distal stump. And if we go towards the inferior aspect, this is a bit tendinous, but the tendon becomes normal in morphology as we go distally. This is overlying the ankle, and we are able to see the tibialis anterior going onwards and medially over the navicular. So that is the tibialis anterior. There is a full thickness discontinuity in this region. So this would be the full thickness tear, and the patient had been operated for it for similar injury in the past, and I suspect that this bulbous thickening or tendinosity of this reflects the prior injury related changes, and it might be at the site of this weakening that the patient again had gotten a rupture. So just beyond that, if we go a bit laterally, we'll be able to see this tendon. This is the myotendinous junction. This would be the extensor hallucis. This is the myotendinous junction, and if we go inferiorly, we'll see there is again discontinuity of the tendon, and we are not able to visualize this tendon. Again, as we go distally, we are seeing this extensor hallucis tendon, and we'll go up to the distalmost cuts. See, we are able to see it going medially over to the first toe, and this would be the slips of the extensor digitorum tendon. So there would be four slips, and if of that the medial two slips, so those supplying the second and the third digits, they also appear to be injured in this region. See, we are not able to see this continuity in this region as well. So there are multiple tendons which have been involved. There are certain fluid gaps within this region which would suspect which we would suspect it to be from the muscle injury. So one more thing that we need to keep in our mind is the neurovascular bundle. This would be the anterior tibial artery, and this would be the veins which are seen along with the anterior tibial artery. These are seen close to the site of injury, and as we go inferiorly we see that the flow voids are maintained. However, there is some amount of compression in this region, but the flow words altogether are maintained. So we need to comment on the neurovascular bundles as well. So this would be the vascular bundles. And talking about the neural bundles, we will see that the peroneal nerve, the superficial peroneal nerve, would be seen tracing along this anterior tibial artery and the vascular bundle. So this, in this region, there should be the nerve as well. So we should comment whether the nerve continuity is maintained or not. Here we see that some amount of edema is there. However, the gross continuity of the nerve as well as vessels is maintained. This is the diffuse edema which we see on the anterior aspect. And I'll just take in a sagittal section where we are able to appreciate the tone ends well. So this is the length of the gap which is seen in between the tibialis anterior. And if we go a bit laterally, we'll be able to see the extensor hallucis tendon gap as well. So this kind of cut injuries, they come in construction workers commonly, and we just need to trace the anatomy, and we should be sure about tracing the entire tendons, not just the area where there is a clinical suspicion. If we try and see the anatomy carefully, we'll be easily able to trace all the tendons. Thank you.